As healthcare costs skyrocket and retirement savings dwindle, more attention than ever before is being focused on the subject of healthcare reform. North Dakota Senator Kent Conrad and a panel of policy experts join us in the Prairie Public Studio as we discuss the issue that is one of President Obama's top domestic priorities. Hi, I'm Matt O'Lean. Welcome to Divided We Fail, a forum on healthcare reform. Joining us today in our Prairie Public Studios are North Dakota Senator Kent Conrad. He's the chairman of the Senate Budget Committee, and he serves also on the subcommittee on Social Security, Pensions, and Family Policy. Also here, Andy Stern, president of the Service Employees International Union, the second largest labor union in the United States, and one which has identified healthcare as its top priority. Also with us is Bonnie Kramer, the National Board Chair of the AARP, who is widely regarded as an experienced budget and human services expert. Also here, Kelly Pearls, Public Affairs Coordinator for the Fargo-Moorhead Chamber of Commerce, which represents 1,900 private, public, and nonprofit member firms that collectively employ more than 85,000 people. And finally, Woody Barth, Vice President of the North Dakota Farmers Union, the state's largest general farm organization, which was founded in 1927 and today represents more than 42,000 farmers, ranchers, and rural citizens. Welcome also to our studio audience, and thank you for participating today in this important healthcare reform panel. Before we begin, our panelists would like to make an opening statement and talk about their critical concerns for their organizations and what they see as the crucial things regarding healthcare reform. Senator Conrad, you go first.
Thanks, Matt, and first of all, thanks to my fellow panelists, and thanks certainly to Prairie Public for putting on this forum. It could not be more timely because this is very much the focus in Washington right now, healthcare reform. And I think the reason is people are hearing from their constituents, as I'm hearing from mine, that this is really high on the list of people's thoughts about things that need to be changed in this country. As I go across North Dakota, over and over, cost comes up with respect to healthcare reform. I was stopped a couple of years ago on the street in Bismarck by a very close friend of mine. Businessman, provides healthcare coverage to over 100 employees there. And he just received his latest premium increase, an 18% increase. He said, Kent, this is the third year in a row I've had an 18% increase. He said, I want to provide health care for my employees, but I can't continue this kind of cost increase. Very dear friend of mine who's a farmer in southeastern part of the state stopped me on a recent trip and said, you know, Kent, our health care premiums have reached $1,000 a month, and we simply can't afford it anymore. We've dropped all health care insurance. And he and his wife are in their 60s. So businesses, individuals, and now even government. I'm chairman of the Budget Committee, and I can tell you the United States government cannot afford these ever-escalating costs either. In our country, we're spending about $1 in every $6 in health care. They tell us if we stay on this trend line, it'll be $1 of every $3 by 2050. Now, clearly that's unsustainable. That would break not only families and businesses, but the government as well. So cost has got to be high on the list. Second thing I hear most frequently is a concern about choice. People want to be able to choose their own doctor. They want to choose their health plan. They want to have that option. Third thing, and again, this is not in any particular order, but it's the kind of thing I hear all across the state, is coverage. We've got 67,000 people in North Dakota that don't have any coverage. Over 46 million people in the country who don't. So making certain that people have coverage and access to care are critically important. And finally, quality. After all, that's really what people are focused on. They want to be assured if they or their loved one is ill, that they've got the highest quality care. And that's really been the great success story of American medicine. And if somebody is sick, they want to come to America for treatment. And I think all of us know we have been blessed by high quality care. And that's got to be maintained and really improved, because we also know in most of the now international rankings, the United States, while we're by far the highest on the cost side of the equation, we're not doing so well on overall quality. So those are the challenges before us, and I think the time is ripe for not only this debate, but for legislation to address these issues.
Okay. Andy Stern, opening statement.
Well, first of all, I just want to say it's a real honor to be here with Senator Conrad. For all of you who don't know, in North Dakota, he really is one of the most respected leaders in the United States Senate. So to be in his home state, I thank you for everything you do every day. I also want to say it's great to be in North Dakota, like the rest of the country, where people who work hard, who take responsibility for their families, are able to hope that they can actually live a decent life. But more importantly, dream that their kids and their grandkids will live a better life than they do. That is the unique and wonderful American dream. And yet today, I think too many parents like myself kind of wonder what is going to happen to my kid or my grandkids. Where are they going to find the good jobs? And how in the world are they going to be able, as the senator said, to afford health care? I mean, when you understand in North Dakota since 2000 to 2007, health care premiums went up 72%, but wages only went up 26%. That's just not sustainable. And it's not just the economic cost, there's personal tragedies involved as well. I mean, there are people like Helen, who lives here in Fargo, who I understand, had to have her husband sell her business when her diabetes got bad. Then she had to take care of her husband 24/7 to the point that she got sick. And then she unfortunately had to put her husband in a nursing home where he didn't live very long. It was not the setting he desired to be in. Or there's women like Ann, a mother whose kid has $350 a month in asthma costs, almost a third of her monthly income. That's not the America we want, and that's not the America we need. And as the senator said, we are at a moment where our country and our companies and our family budgets all depend upon doing something about health care. And what is so great about what's happening in Washington, D.C., and what you see on this panel is you have business and consumers and unions all working together for the first time and saying, solving the healthcare problem is not a Democratic problem or a Republican problem, it's an American problem. And everyone now is beginning to work together. And I think in the next 9 weeks, you will see exactly what the senator talked about. A plan to lower costs, a plan to have real choices, a plan to deal with prevention and wellness and finding the cures to the diseases in the future. This is an exciting moment in Washington, D.C., and I want to just congratulate the senator, but congratulate everyone who's worked together to try to make this moment be a moment where dreams still can come true in this country.
Okay, thank you, Andy. And Bonnie Kramer, opening statement.
Well, good afternoon. I speak to you this afternoon as the chair of the National AARP Board on behalf of our 40 million members nationwide and our 88,000 members here in North Dakota. And I, too, would like to thank Senator Conrad, who has worked so hard on the issues that are important to AARP: retirement, Social Security, Medicare, and very much for your work on comparative effectiveness. And Senator, we look forward to continuing our work with you on health care reform. I want to take my time this afternoon to quickly sketch out for you where AARP is on health care reform. First, we are very optimistic about health care reform. For the first time in 15 years, we believe that we stand a real good chance of improving the nation's health care system. And as the Senator and Andy Stern indicated, things have gotten so much worse since the 1990s. Employers are struggling. Small businesses are unable to provide insurance for their employees. The number of uninsured have grown. When we have prescription drugs that are increasing at cost at 2.5 to 3 times the rate of inflation, it's just simply not sustainable. And I think one of the biggest things that we have going for us that we didn't have 15 years ago is that big business, who fought so hard against reform in years past, have also said that these kinds of costs are not sustainable for their businesses. So we do have a new day, new atmosphere, and I want to sketch out very quickly for you what AARP's priorities are for health care reform. First and foremost, we want to guarantee affordable coverage for our members who are age 50 to 64. Now that's about half of AARP's membership. Secondly, we want to close the coverage gap in the Part D prescription drug coverage under Medicare. And Senator Conrad, I have to tell you that's a big problem here in North Dakota, with 33% of North Dakotans who have prescription drug coverage under Medicare who fall into this coverage gap, into this dreaded donut hole. Third, we want to prevent costly readmissions to the hospital from Medicare recipients. We know from studies that about 1 in 5 individuals who receive Medicare and are discharged from the hospital go right back into the hospital within 30 days. This is too costly. We can't sustain it. It's waste in the system. We also want to increase funding and support for states across the nation for home and community-based services so that older people can remain in their homes for as long as they want. And one of our top priorities is to create a path to generic drugs for biologic drugs. I was fortunate enough to be able to afford a biologic drug for many years for my rheumatoid arthritis, and I can't tell you the number of times that as I paid my bill at my doctor's office, I had individuals behind me where that help was just out of reach. Our final priority is we want to improve the programs that provide assistance to low-income people on the prescription drugs and health care. I just want to say just a word or two about these points in our conversation together. First of all, you may be surprised to hear that our top priority is providing affordable coverage for those 50 to 64. Now, these individuals are not yet eligible for Medicaid. These are the baby boomers across the country. And why we have over 13 million in the country who are uninsured, half of those work. I understand here in North Dakota there are about 12 million individuals that fall into this age category, and out of 12,000, and out of that 12,000, 10,000 are working full-time at jobs. These individuals cannot afford coverage. Often when they try to buy insurance on the private market, in 28% of those cases they are denied coverage because of pre-existing conditions. And when they are successful in buying coverage, they pay about 3 times what their employed colleagues do. So we need to take care of this situation and guarantee affordable coverage for these individuals that are 50 to 64 years of age. We need to have some common sense solutions to these individuals. I have already mentioned to you the concerns that we have about the coverage gap in Medicare prescription drug coverage. This is a high priority for individuals. Again, it is a big problem here in North Dakota. When people get into that coverage gap, they pay the full cost of their medications and they continue to pay the premiums for their insurance coverage. We need to close or narrow that gap. So I'm going to stop here. Those are our 2 major priorities, affordable coverage for 50 to 64-year-olds and narrowing or helping to close the donut hole. Thank you.
Thank you, Bonnie, for that. Kelly Pearls, your statement.
Thank you very much for having us, and thank you, Senator, for your important work that you're doing every day on our behalf in Washington, D.C. It's been really wonderful to be invited here today. And David Martin, the president of the Chamber of Commerce of Fargo-Moorhead, frequently says that you are the smartest man he knows. And so I'm looking forward to having your voice at the table.
Limited circle.
Well, certainly I think it comes with distinction, and so you deserve that. The Chamber of Commerce of Fargo-Moorhead, as you know, and as was mentioned earlier, has a strong interest for our members in looking at healthcare. In fact, healthcare has been the Chamber of Commerce's first issue or primary issue, surpassed by the workforce issue very recently. But the continuation of healthcare and the demands on employers to be able to continue to offer health insurance coverage to their employees. A lot of our members do not or are not in a position to sustain that. As was mentioned earlier, the rise in healthcare premiums for group coverage exceeds the capacity of many of our members to sustain. And even when they are able to sustain that, it's at a hardship to their business, and it affects their business, their bottom line, essentially, and they have to, reallocate funds to have this be a priority. One of the things that I think is very interesting is that while many employers do provide health insurance for their employees, that does not automatically mean that the employees' families are then covered. Many employers are just simply not in a position to be able to afford to provide group or family coverage under their group benefit plan. The cost is just too high. One of the things that the Chamber of Commerce has been working on, and we have had a health care sort of task force of the Chamber's Regional Issues Committee that has taken a look at what is the government's role in healthcare reform, what is the employer's role in healthcare reform, what, did I say governor? I meant government's role, governor too, but government's role in healthcare reform, what is the insurer's role in healthcare reform, what is the provider's role in healthcare reform, and this committee met diligently for a year and a half and examined not thoroughly every issue, but touched on every single issue, and in its conclusion, they came back to where we started, which is people just need to not, people just need to take better care of themselves. That's really the driver for so much of what's happening. Now, I don't want to make it sound like the Chamber of Commerce says, oh, you people, you need to take care. It's that this system needs to work to keep people well, as I think the conclusion that was drawn upon. Last year, the Chamber of Commerce had its regional and community and business interests survey, and I brought along the responses that were given by a great number of our members in terms of business priorities. And the number one response under healthcare priorities is promotion of wellness, promotion of wellness and disease prevention. Now, understanding that not only does that drive up the cost of healthcare, we've all seen information about the high dollar amounts that people have if they are at, with diseases, but really I think that this is more of a productivity issue when it comes to wellness as well. Businesses very much have an interest in the productivity of their workers, seeing their bottom line, seeing their absenteeism, seeing their turnover rates not be so high. So our members are interested overwhelmingly in understanding how they can help play a part in improving the health of their workers and ultimately to the people in this community. Some other high-ranking information are some of the ideas that are floated around in Washington, D.C. and other places, receiving quite a lot of attention in terms of removing waste in the system. 29% of our members indicated that's a high priority for them to increase transparency in the healthcare system, but 14% also say that implementation of the electronic medical record is an important priority. I know that that's something that has been at the forefront of a lot of discussions in terms of reducing costs in the system, and that is something that we look forward to seeing. To the extent that the business community can be involved in helping their employees to have coverage, remain covered, meaning controlling the costs of increases or even controlling the costs at all of obtaining health insurance for their employees. One of the things that has long been a part of the Chamber of Commerce legislative agenda is allowing for the small company purchasing pools where small companies can band together and be able to therefore qualify to purchase into healthcare plans. I know that that's something of the Chamber of Commerce that we highly recommend and realize is an important priority. Interestingly enough, this surprised me when we looked at the healthcare priorities. increasing walkability and bikeability of the community was 34% of our members said that they want a healthier place to live because they think that that ultimately does impact the overall health status of their workforce. And with that, I will look forward to answering any questions that you might have.
Thank you, Kelly, very much. Woody Barth, finally, opening statement.
Thank you, Matt, and thank you to Senator Conrad for being here today and for the good work he does as representing us in North Dakota, for North Dakota down in the United States Senate. Thank you. Thank you to AARP and Prairie Public for sponsoring this today. This is very important and important to North Dakota Farmers Union members to have this panel put together. My intentions today are to speak about healthcare reform and as it affects rural North Dakota. I farm and ranch near Solon, North Dakota, full-time farmer down there, and I represent North Dakota Farmers Union and its family farmers and ranchers members. They have a unique position here in North Dakota as well as the United States. They're essentially small business people who incorporate their entire family into their operation in order to feed the world. They purchase insurance at a non-competitive group rate and actually spend about an average of $4,000 per farm, per farm family, more than group coverage would cost them through a group. So they do pay a substantial amount of money more towards their healthcare costs, being they aren't able to buy into a group as was mentioned here before. As a result, many farm families, one member of that household works off the farm to provide healthcare coverage for that family farm and ranch unit in most of rural North Dakota. And a good example is my home area. Many farm spouses as well as the wife or the husband both work off the farm basically for healthcare coverage to keep those operations going and unable to afford healthcare coverage themselves. We at North Dakota Farmers Union and our members support affordable healthcare, comprehensive healthcare plan that will enable all citizens of North Dakota and United States to achieve and obtain healthcare coverage and prescription drug coverage that will help them in their well-being as family farmers and ranchers. So, Matt, thank you.
Okay, thank you, Woody. Our first question comes from our studio audience, and as I asked Senator Conrad this question, when he's done speaking, panelists just jump in and get the discussion moving, whichever way you want to take it. But the question is, medical care can be expensive even for workers with health insurance. Senator Conrad, the question, how will Congress reduce costs for middle-class workers, and how will out-of-pocket costs be kept from breaking people financially?
Well, that is the question that I get all across North Dakota. So whoever asked that is right in tune with the people of North Dakota. One of the things we've discovered in these extensive discussions we've been having about the options for healthcare reform is what are the drivers? What are the things that are really driving up healthcare costs? And one of the things that jumps out at you is that 5% of the people in Medicare use 50% of the money. They're the chronically ill. They're people with multiple serious conditions. And my own belief is we don't do a very good job of coordinating their care. A number of years ago, a pilot project was done that involved 20,000 people in this category, people with chronic illnesses. And they put a case manager on every one of their cases. And the first thing they did was go into their homes, get all the prescription drugs out on the table. And what they found is on average, they were taking 16 prescription drugs. After a review, they've cut that number in half. The result was they dramatically cut down adverse drug interaction. They cut down the number of hospitalizations. They had substantial financial savings, and they got better healthcare outcomes. The people were healthier. They were better off. You know, in my own father-in-law's final illness, we did the same thing. We went into his house, went to the kitchen table, got out all his prescription drugs. Sure enough, he was taking 16. And I got on the phone to the doctor, went down the list, and we eliminated 8 of the 16. And I said to the doctor, how does this happen? He says, well, Kent, he's got a heart specialist, he's got a lung specialist, he's got an orthopedic specialist, he's got a family practice doctor, he's getting prescription drugs from the corner pharmacy, the hospital pharmacy, he's getting a mail order, he's sick and confused, his wife's sick and confused, we've got chaos. And all too often, that's exactly what we've got. And we've got to reduce the chaos, reduce the confusion, get better care coordination. I believe we'll get better health care outcomes and save money for everyone.
Any comments? Jump in, Bonnie.
Senator Conrad, I couldn't agree with you more, and that is one of the reasons that AARP is supporting what we've called the transition benefit, and that is to try to give individuals, particularly those receiving Medicare who are discharged from the hospital, better follow-up, because this whole notion that 1 in 5 is readmitted to the hospital within 30 days is usually because they haven't seen a doctor within that period of time. They have new medications, they don't know how to use them, they don't know how to look at the interactions of drugs. But it extends beyond the chronic management as well. Some of the AARP staff here in North Dakota heard me last evening talk about the fact that my 88-year-old father, who still drove, still had a job, and had the best garden in the neighborhood, was the victim a few years ago of an egregious medical error. And this, he had never taken medications, but when he was patched up after months, he ended up taking a number of medications. And so for the family to manage the medications, to keep him going to the doctor, to take the best care possible, it is really something that does fall on families to do. So this whole notion of better chronic care management, these high-cost individuals, is something that we need to give a great deal of attention to in any kind of efforts to improve health care.
Any others?
I just want to say
Andy?
what Kelly and Woody are talking about, thank God we're talking about finally in Washington, D.C., is how do we let small business people, farmers, ranchers, buy into a bigger pool? And to the credit, the insurance industry now understands they're under pressure. People aren't really happy that you have a pre-existing condition or something goes wrong, you can't get insurance or your rates go up. And I think we're going to see, sometime, I hope, with Senator Conrad's leadership in the next 9 or 10 weeks, a plan that will allow the small business person, the rancher who want to do something but can't afford to do it, to have a much bigger exchange, whether it's a regional exchange or a national exchange. And I think we're going to see a chance to have a public option, which will even put more competition into the system. So, competition is good, but small business really needs a chance to purchase the way big business is able to do, and that will cut their costs dramatically.
In a previous survey of our Chamber of Commerce members, we asked the question about, do you provide health insurance for your workforce, and what are some of the concerns? And by far, it was the #1 issue when that survey was tallied. One of the things that employers were reporting, and this was 2 years ago now, that they are having to scale back their benefit in terms, so increasing the deductible, which enables them to continue to provide the group health benefits, but it actually increases the impact of health care expense on an individual, which I know is a priority for you, Senator.
Kelly, I was describing this friend of mine who runs a business in Bismarck. He's been very successful. He's got over 100 employees. And can you imagine, 18% increase in his premium 3 years in a row. And he said, Kent, I've always provided health care. I'm going to continue to do it. I want to. But I really have now got to ask the question, can I afford to? And he was doing exactly what you've described. He was increasing the deductibles. He was asking employees to pay a bigger share in order to maintain coverage. But I hear all across North Dakota from businesses, from families, farm and ranch families particularly, because Woody, you're exactly right, they pay much more because they don't have the same leverage. They don't have the same negotiating power because they're not in, as Andy describes, a big enough pool to have leverage. So that's going to have to be part of any reform that we pass.
Let me get a quick comment from Woody. Do your members of your group seem willing for some sort of reform at this point?
Oh yes, North Dakota Farmers Union has long-standing policy asking for some kind of reform, some kind of help to help family farmers, ranchers, rural citizens ascertain or obtain affordable health care coverage. I've been involved with adult farm management for the last 30 years. North Dakota Farmers Union has worked closely with adult farm management. When I first started 30 years ago with adult farm management, the bottom of the list of the family living expenses was medical cost. Now today, 30 years later, the top of the list on family living expenses is medical costs, prescription drug costs. So that's gone from, you know, the bottom to the top of #1 expense for family farmers and ranchers as it pertains to their family living.
Senator, quick question, and others can jump into. We often hear from critics, nobody wants government-run health care. You hear that a lot, I'm sure, in Washington, D.C. What makes this plan that President Obama has proposed or will be kind of working its way through Congress different, let's say, from the 1994 President Clinton and now Secretary of State Hillary Clinton plan that did not make it through? And is the climate different now, too, than in '94?
Well, the climate's very different, and this isn't going to be government-run health care reform. This isn't going to be a system like the Canadian system or the British system. It's not going to be government-run. They're clearly not the votes for that. And I think people have a different view of the direction we ought to take. And so what I do think we'll see here is that this will be private sector plans. People will have a choice of what plans they join. They will be part of large purchasing pools, so they have leverage, so they get better rates, so they have more negotiating leverage, if you will. The government will have a role, and the role for government is for those entities that can't afford, whether it's an individual or business that can't afford to buy the coverage, that government will provide some assistance. And, you know, some people say, well, we don't want the government involved in any way. I don't think it's possible to get coverage or close to full coverage without having assistance for some. You know, you have people who are disabled. You have people who are in dire poverty, simply can't afford it. You have small businesses who simply can't afford to offer health care coverage at all. And so if they're going to be part of the solution, and it is going to be an employer-based system, that's largely what our system is today, it's going to continue to be an employer-based system. So the role for government will be to provide some assistance to those who couldn't otherwise afford coverage. And frankly, that's in all of our interest, because even if they don't have coverage, they do get treatment. And where do they get the treatment? They get it in the emergency room, which is the most expensive place to get it.
Well, and I just want to add a point, excuse me, on that. That is often repeated, that going to the emergency room is the most expensive place. But one thing that is oft mentioned at the Chamber of Commerce is that the cost of those visits for the uninsured are really being laid onto the private payers. Yeah, exactly. Because there is a cost shift, and the cost shift goes to those businesses that provide group coverage, and their premiums are going up even though their group isn't necessarily accessing this very expensive care, because hospitals have to, providers have to, they can't sustain their operation without it.
I wanted to make a couple of comments, Kelly, related to that, and also Senator Conrad, to your point. It is true that those people who have insurance are subsidizing those who do not have insurance. And there really some startling information in terms of studies to show the extent of what that cost is to a family on average throughout the country. Some of those studies show that it's about $950 for a family of four, or over $300 for an individual coverage. So it's substantial, those who have insurance, to pay for those who do not have insurance. And then Senator Conrad, I also wanted to make a comment about the proper role of government. At AARP, we certainly support the strong employer-based system that we have had in this country. But you talked about the proper role of government as to provide for those who can't provide for themselves. But there's another aspect to that as well. I spoke about our strong support for those who are 50 to 64, and we certainly believe that everybody should have insurance. But we can't simply mandate that everybody have insurance unless we have a way to make it affordable. And to go back to an example that I've used before, because I think it's so important, and I think it's one that a lot of our citizens don't understand. For those people who are 50 to 64, half of those individuals are working in small business, and we've talked about the difficulty of small business affording the insurance. And when they go to the private market, about another 30%, like me, would have a pre-existing condition that makes the insurance unaffordable. So we believe that a role of government would also be to provide reasonable subsidies in the case of a mandate that would be requiring people to have insurance that would cover all of our citizens. And so that we have the private sector, we have the public sector, and we have an individual who is taking the responsibility to make sure that they and their family are covered, has a reasonable chance with a pre-existing condition to afford insurance on the private market.
You know, you make a very good point. And another role for government is to get the incentives right. Because right now, the way our system works is we pay for procedures. So we get a lot of procedures. Whether they're particularly effective or not is another question. And one of the things that I think is quickly becoming a consensus is, you know, we really ought to be paying for outcomes. We ought to be paying for people getting healthy, having a wellness system rather than a sickness system, and also to encourage people in healthy living. You know, we've got an epidemic of obesity. That's a time bomb waiting in terms of cost and illness. And, you know, we see these other issues as well. We know that people need to be physically active. We know we need to eat better. I mean, all of us could take that lesson. My wife reminds me all the time, eat better, get your exercise.
Matt,
Go ahead, Woody.
could make a point. Also, concern to North Dakota family farmers and ranchers is access to health care. We have a lot of citizens in small towns, family farmers and ranchers. As they age, as the population ages in rural North Dakota, we have to make sure that they have access to health care. A lot of these citizens, their closest provider of any kind of major health care services is 75, 100 miles away, and if some illness strikes that family, they have a long way to go for treatments that might be daily or sometimes twice a day treatment. So we've got to make sure there's access to health care for those rural citizens, and through telemedicine or some kind of subsidy cost or cost factor, the government needs to be aware of that. We want to try and keep these people in rural North Dakota, rural America, but yet have access to health care that helps them stay in rural areas.
One of the biggest challenges in this state is that we are near the bottom in reimbursement under Medicare. In this state, Andy, we get half as much to treat the same illness as a hospital in New York. Half as much. And we don't get any rural discount when we go to buy technology. We don't get any rural discount when we go to recruit a doctor. In fact, we know that it costs more to attract a doctor here than the East or the West Coast. So we've got a system that's unfair, and it's really topsy-turvy because we're at the bottom in reimbursement, but we're in the top 5% in healthcare outcomes. So we've got a system that's upside down in terms of federal policy. And that's we've got more than 40 hospitals in our state. In the last several years, I've been to every one of them and had a healthcare forum. And I can tell you what Woody is talking about is a growing concern, because our hospitals are, the significant majority of them are facing negative margins. They are losing money. They are losing money. And if you lose money for very long, you can't stay in operation. And if the hospital's not in operation, there's not going to be access for the people out in the rural areas.
And birthing units have shut down in a lot of the rural hospitals, correct, Senator?
We
Because
see
they just can't make money.
they can't make
Right.
money. And so what that does is put more and more people to go longer distances for care. Yesterday I was at the VA hospital here in Fargo, and we were announcing some pretty exciting things that are happening at this facility. And one of the best examples of what they've done there is medical records. They have electronic medical records. So that helps cut down on medical errors. That helps with getting better healthcare outcomes. And when we had the people have to be evacuated to Minneapolis and other places because of the flooding here, that electronic medical record was available for them when they arrived at the hospitals that they were sent to. And that's something we're going to have to do across the country as well. Make it possible for everybody to have an electronic medical record. So when a doctor treats you, they know what other diagnosis has been made, what prescription drugs you're on, so we have the right hand knowing what the left hand is doing. That'll save a lot of money, reduce medical errors, get better outcomes. That's an exciting prospect as well.
Senator, where do you expect I know President Obama recently had a big healthcare forum with all kinds of groups represented. Do you expect pushback from HMOs, health insurance companies? Where do you expect opposition to come from, or is that opposition kind of slowly weeding itself out?
I see, as Andy described, I see greater consensus, greater support for acting than we've ever seen before. Bonnie, you mentioned this too. I don't think I've ever seen such an agreement that we got to do something. We simply can't stand pat. We're on an unsustainable course, and healthcare reform is essential. The trick is, of course, to get it right. And we know that any enterprise of this magnitude, there are going to be mistakes made. It won't be perfect. It won't be just a one-time event. We're going to probably have to come back and change things that aren't quite right. But we have got to make progress, and we've got to do it now.
And I think what we now understand in Washington, which I think people weren't wise enough to know in 1993, is two things. One is the longer we wait, the worse it gets. And the second is that we used to say that our second choice was always do nothing. And I think what we're seeing now is for American businesses, for small businesses, for farmers, for families, for our country, doing nothing is no longer an option. And I think that's what's driving this change. And I'm excited. I think in the next 10 weeks, we will pass bills in the Senate, and the House that will put in the way towards fundamental change for all the things that we talked about in terms of being able to purchase, about wellness, about prevention, about medical records. We are on the verge of doing something that we failed to do for 233 years in this country, and we should be very proud of it and make sure it gets done.
What are the key pieces then of the legislation, Senator? I mean, everybody's kind of talked about what they want in there. Is it making sure all those pieces are in the puzzle, and what are maybe the top pieces that have to be in this legislation if it's passed?
I think I'd end where I started. We've got to address cost, because that is threatening every part of the system. That is threatening families, it's threatening businesses, it's threatening governments. We've got to have cost control as a component. Choice has got to be a central part of anything that's done here. People absolutely want to know that they're going to be able to choose their doctor, they're going to want to choose their provider, they're going to want to choose their plan. Coverage. We've got to make certain that this 46 million of our fellow citizens have access to health care coverage and have it in a way that's effective. And quality. I mean, at the end of the day, if you or your loved one is ill, you want to make certain that the best quality of care that is available anywhere is available to your family. We had circumstances in our family where in the last several years, illnesses. I just had one of my top staffers have a very rare disease, is in the hospital for weeks, and they couldn't figure out what it was. They found out he had a very rare genetic condition. And we were able to find the right people for him to see. That's what people want at the end of the day. They want to know that if, God forbid, something bad happens to them or their family, they're going to have quality care available to them.
Is there bipartisan support as it stands now? What are you
I have
sensing?
been really encouraged. In these meetings, some of them 7 hours in length. In fact, we've had 3 that average 7 hours in length. That's a long time to debate healthcare options. It was fully bipartisan. There was many Democrats and Republicans on the committee sticking through those long hours of discussion. And I was very, very encouraged by the attitude. Now, at the end of the day, are we going to have, everybody agreeing? No. We know that there will be people that, for whatever reason, can't agree. But I must say I've been incredibly encouraged by these meetings, and these were meetings of members of the committee going over all of the options, and we've been doing it now for 2 years. We had the Healthcare Summit last year under Senator Baucus's leadership, and now we've had extensive hearings last year and this year, culminating in these roundtables in which we call in experts of every different stripe, of every view, of every belief, and then these meeting of members where we have gone over in great detail what are the elements of a plan, how do you finance it, how do you save money, and it's been totally bipartisan.
Senator
Woody, go
Conrad, as well-respected, or chairman of the Budget Committee, well-respected throughout the nation as a budget leader in the United States Senate. Is it going to be affordable, or can the United States government afford to do what needs to be done? Do we have the resources to do
Well,
it?
Woody, that's the great challenge. Senator Baucus, we just had a meeting, and Senator Nelson of Florida turned to Senator Baucus and said, look, can you pay for this plan that you're going to come out with? And will you pay for it? And Senator Baucus said, I will, and he'll make me. And he pointed at me. And I
Because
will.
you've been on record, even talking to President Obama, that things have to be a little under control here with deficit spending.
Look, this is to me, the truth of the matter. We're on an unsustainable course as a country. We're piling up deficits that are too big, debt that is too much. We understand in the short term, with an economic downturn, that happens. But longer term, we have no choice but to turn in a different direction as a country. And the reason is simple. We are financing a debt, and we're increasingly financing it abroad. Last year, 68% of the debt of the United States was financed by foreign entities. China is now the #1 creditor of the United States. That can't continue. We're on a trend line that is unsustainable. Healthcare is the #1 culprit because the healthcare accounts of the federal government are going up the most rapidly in cost. We have massive unfunded liability of the United States in the healthcare accounts. So we have no alternative but to turn the page, move in a different direction, and that's a key reason healthcare reform is critically important.
Bonnie, I have ask you a two-pronged question because I know a lot of seniors are watching this show. Will the Walmart or internet pharmacies help seniors with prescription drugs? And number two, I know if Medicare continues as is, they're talking that it'll be broke eventually. And so those are kind of a two question for seniors that they might be concerned about here. And then the donut hole also, I read about that as a concern.
Well, let me start with your middle point
All right.
first of all. You know, the Medicare Trust Fund, the report has been issued, and actually it shows Medicare, the trust fund, going broke even 2 years earlier than we had anticipated. So it is a problem that we need to address. But we were talking earlier about whether or not we can afford to reform healthcare with the economy as it is and with the kinds of things that we've had to do to stimulate the economy. And I think the question is we can't afford not to do that because healthcare cost and the increases in healthcare inflation is such a problem, as we've heard from the panel, for business, large and small, for farmers and for families who are trying to pay. Now, we have at AARP, we have talked to our volunteers across the country. We've done that this morning here in North Dakota. There are savings to be had from Medicare. But and some of those things with the transition benefit from hospital discharge, there are estimates that could save quite a bit of money if we were to do that. Our members poll very high that if there is fraud, waste, and abuse, and we know there is in the Medicare system, our members poll over 97%. They want that dealt with. They want that dealt with providers. They want the improper payments that are made. Those things all add up, to quite a bit of money. One of the things at AARP that we have said that we would support is to take the what some people call the excess profit, but the 14% for Medicare Advantage payments that are made that are higher than the traditional Medicare. AARP has more than 1 million of those policies. We will lose money for our organization, but we think that's the right thing to do, and we've said we will support that. Those are the kind of right savings to get out of Medicare. But what we have also said is that the responsibility to finance improvements and reform of healthcare has to be shared by all generations. And while we want those kinds of efficiencies to be had for Medicare, we will oppose having deep cuts in Medicare that will affect the care that is delivered to Medicare beneficiaries. On your point about prescription drugs, yes, Walmart has been a great boon in terms of generic drugs. But what that doesn't get at is 2/3 of the drugs now that are in the pipeline are biologic drugs. Those are very expensive drugs. They're life-saving drugs. They're the drugs that treat cancer, Alzheimer's, multiple sclerosis, so many of the diseases. And there is a legal block for quickly getting to generic versions of those drugs. That's another kind of savings, that if we could have generic biologics that would help so many people, we would also be able to identify savings that could be associated with that. And prescription drug costs are rising at 2.5 to 3 times the rate of inflation. We have to bring those costs down in order for people to be able to continue to take the life-saving drugs, and for the government to save money, and for the farmers' families to purchase affordable care and affordable insurance coverage. It is a major, major problem in this country. We have continued, Senator Conrad, as you know, at AARP, to support having the Secretary of Health and Human Services be able to negotiate prices for Medicare prescription drug. If the private providers and insurance companies can do it for their members, we think the government ought to do it for Medicare beneficiaries. All of those things that I've talked about would not only provide more humane care, life-saving care, reach vulnerable people, but could generate savings that could be used to help reform and make improvements in health care.
Interesting note, Matt, there was a change, a proposed change to North Dakota's pharmacy law here in North Dakota's past legislative session. And the one thing that came about was that we actually have cheaper prescription drugs on average here in North Dakota than we do in other states that have different pharmacy laws than we do here in North Dakota. Cheaper cost here in North Dakota, and in many cases, that small town pharmacy is the only medical provider in those rural communities and those rural areas that give access to those citizens there for prescription drugs costs as well as any kind of medical advice. So we in North Dakota are fortunate to have our local providers and have those people in those rural areas providing medical prescription drugs and other medical services.
One thing I just
Good.
would
Go
want
ahead,
to say, our local pharmacists are not the problem with high prescription drug cost. They are operating on very slim margins. In fact, they aren't compensated for a lot of the service they provide, because the key to preventing adverse drug interaction really occurs at the pharmacy, because very often they're the only ones that see all of the prescriptions that an individual is taking. But our local pharmacies, I've got to say, I don't think have been treated fairly with respect to Medicare Part D. They are not getting a fair return on their effort. And now a whole new series of requirements has been thrust on them, where they're filling out these huge forms in order to qualify to sell certain things that are just over the top. They're really designed for a whole other level. And so our local pharmacies here are under enormous pressure. And we got to make certain that they survive, because, as Woody says, very often they're the only care provider in an area.
We've got about 3 minutes left. I want to get Andy back in here. Again, couple pieces of crucial things you're looking for in this legislation from your standpoint.
You know, reducing costs and reducing costs and reducing costs, I think is really, you know, what people are talking about here. And I think the senator and everybody else has talked a lot about it. And I also think what we've talked about, we have to have a healthcare system, not a sick care system. And that really does mean we have to deal with our own personal responsibility about our health. We have to make sure our insurance plans, you know, pay for prevention, not just when you're sick, because what we really need to do is keep people healthy. And we have to keep investing in the cures for a lot of these diseases, because I think with genomics and with stem cells and lots of things going on, we are on the verge of a medical revolution that can, you know, provide people a lot of care as long as we deal with the costs of that. But you know, we are at this moment of change, and I'm very excited about the future in America, about its healthcare system.
And Kelly, real quickly, just a couple points you're looking for. Got a couple minutes left here.
Sure, certainly. Thank you very much for hosting this. It's been a delight, and I've learned a lot. Thank you to all of the panelists here. The Chamber of Commerce does represent 1,900 members, and we stand strong in our support for healthcare reform that does not penalize employers who would choose to provide insurance for their employees, and in fact would actually partner if it's envisioned that the whole United States is going to continue this employer-based system. I believe that the employers are ready to stand up, at least the employers here in the Fargo-Moorhead area, and look forward to working with you.
Senator, I'll give you the last word. We've got about 1 minute left. What can people expect in the next 2 to 3 months out of Congress?
Well, I think this is a critical time. This is a moment of opportunity, but it's critically important we get it right. One thing I want to say, just as a note of skepticism here, it's entirely possible we reform health care and bend the cost curve upward. And I've said to the chairman of the Finance Committee, that's going to be very much a focus of mine, because that we would rue the day if we had health care reform and we didn't get these costs under control. That would be very damaging to families, to businesses, and to the country itself. So there's an opportunity here. I believe we've got to seize it, and we've got to make sure we get this right. And I'm confident we will.
Okay. Thanks to all of you. A great panel, Senator Conrad, Bonnie Kramer, Larry Stern, Woody Barth, and Kelly Pearls. Thanks all for this very important discussion on health care reform. You know, health care reform has been talked about for years and is now becoming a critical concern as costs rise and savings dwindle. To learn more about the issues raised in this program, visit our website at prairiepublic.org for links to sites with more information on this important topic. Good night.